Capsule Endoscopy, a medical imaging digital presentation by Louisiana, Mediha, Bianca, and Gina. So what is endoscopy? Endoscopy is a non-surgical common procedure that involves examination of the inside of the body. The procedure includes use of an endoscope, a device made of a long flexible tube with a lens on one end and camera on the other. The lens leading end is inserted into the body through openings such as the mouth, urethra, or anus. Light is passed through the tube to provide illumination to areas of interest that are magnified via a video camera, then such projections are seen through a screen that can be viewed by a doctor. A variety of endoscopes are specialized to procedures of locating, sampling, or removing tumors or foreign objects. During upper investigation, the endoscope is passed via the mouth and throat through the esophagus, providing a view of the stomach and upper small intestine. Such endoscopic techniques are frequented in diagnosis and treatment of the upper tract. However, the small intestine has remained tedious to investigate without surgery.
The field of endoscopy can be dated back to the early 19th century, evolving dramatically with technological advances and still expanding. Endoscopy is a common procedure, but its demand for it and related services continue to grow rapidly. Factors such as the aging of the population, the downstream effect of the National Bowel Cancer Screening Program, and the need for ongoing monitoring of patients with diagnosed treatable conditions all contribute to the growth for endoscopic services. While the complications to occur during the procedure is very uncommon, it is still possible. The use of an overtube presents a risk of perforation of the area being examined, which could result in excessive bleeding or an infection. Additionally, those who have been sedated may experience side effects such as feeling sick and nauseous, a burning sensation at the site of the injection, trouble breathing, develop low blood pressure, or irregular heartbeat. Despite these risks, it is encouraged to undergo the procedure when recommended. Modern endoscopic techniques have revolutionized the diagnostic and treatment of diseases of the upper gastrointestinal tract and the colon. However, the distal small intestine has still been a difficult organ to make a diagnosis and treat without performing surgery. Radiological procedures follow through, but they are time-consuming and not accurate in identifying small tumors and other subtle abnormalities on the small intestine. Improved diagnostics will be very useful in uncovering causes of abdominal pain, diarrhea, and anemia due to intestinal blood loss, and also diagnosing diseases that may only involve the small intestine, for example, Crohn's disease.
Although imaging technologies such as upper gastrointestinal series exist, they impede applications due to lack of precision and an inability to identify subtle abnormalities. A means of addressing this clinical implication was to expand on the diagnostic capabilities of the small intestine with the introduction of capsule endoscopy. Capsule endoscopy is used to investigate the small intestine and has assisted in diagnosis of inflammatory bowel diseases such as Crohn's, detection of polyps, ulcers, and tumours. Prior to conduction, use of laxatives and purges are required to clear the intestines of food residue and bacterial debris, as this may obstruct view. The process involves a swallowed video capsule which consists of 1 to 2 cameras, a light bulb, battery, radio transmitter, as well as a receiver which is worn on the patient's waist. Travelling to the stomach and small intestine via the esophagus, images are recorded quickly and transmitted through a radio transmitter. The capsule is passed naturally and retrieval is not required. Images are then exported onto a computer, generally 8 hours post-op, and physicians can obtain and view them. Hence, capsule endoscopy has provided a non-invasive, painless and elegant form of imaging technology that demonstrates direct visualization of the small intestine, which through conventional endoscopy would be unattainable as such anatomical regions were previously limited by view.
Since its introduction to the clinical setting 20 years ago, capsule endoscopy has revolutionized the management and investigation of small bowel diseases. It addresses issues arising in the management and practice of imaging technology, which we can see through comparing a list of pros and cons. Capsule endoscopy has expanded the fields of application, allowing for a higher diagnostic field compared to other imaging modalities. It also has increased access to anatomical regions unattainable by conventional endoscopy. It can directly visualize mucosa of the entire small bowel, which has contributed significantly to the diagnosis of Crohn's disease. Additionally, capsule endoscopy has benefited the overall patient well-being by being non-invasive, convenient, following a simple process that does not require sedation, while also contributing to enhanced safety measures. While there are many pros to capsule endoscopy, there still remain limitations. Capsule endoscopy lacks the ability to control locomotion, specifically through the gastrointestinal tract. There may be oversight of lesions in the small bowel, impairing visualization due to food material or bubbles. Capsule endoscopy cannot perform sufficient air insufflation, which is a technique used to obtain greater scope and better visualization in conventional endoscopy. Capsule endoscopy also lacks biopsy and therapeutic abilities, and with a limited battery life, the capsule may become depleted before the examination is complete.
Since its initial fruition in 2001, video capsule endoscopy has paved the way for gastroenterological examination, allowing doctors to directly view mucosa of the small intestine for the very first time. Despite this, there remains great challenges limiting its widespread use, specifically with the detection of the capsule's location within the body as its greatest engineering challenge. However, within the near future, scientists are working to utilize artificial intelligence and machine learning technology to combat this limitation. This could proliferate to even encompass robotic capsule control within the abdominal screening process to minimize reporting time and human error for more accurate diagnosis. Over time with development, colon capsule technology may advance to completely replace conventional colonoscopy for patients who refuse such treatment. Its expanding use in specialized medicine is dependent on technological advancements, and with this, if capsule endoscopy is going to continue in its path to benefit patients while simultaneously improving with technology, it may even come to entirely substitute conventional colonoscopy practice. Overall, posing as an extremely safe, universal and reliable device, capsule colonoscopy has proved to dramatically improve the diagnosis and management of small intestinal diseases that have significantly benefited a range of patients. As more research is done and it progressively continues to improve patient care whilst reducing the cost of healthcare, capsule endoscopy entails serious and vast opportunities to advance gastroenterological medicine practices and understandings.